is required.
Okay. So we're doing a project over a licensed marriage and family therapist, and just kind of going to be asking some questions about, you know, how you came to where you are, why you chose this practice and everything. So first question is, how did you determine your specialization?
Well, I haven't thought about it that way. Well, I think for all psychotherapists, there's probably whatever the formative early experiences of their own life and how that leads them to kind of sort through what their interests are. My parents didn't have a very good marriage, so I was kind of caught up in that from early on. Then I just, by happenstance, I went to California in the 1960s to go to theological seminary and met Virginia Satir, the great family therapist, one of the pioneers, and other therapists at that time. And I got hooked by the vision of seeing families as an organism rather than as individual parts. Okay, so I really began to study marriage and family therapy at that time, and found it was quite interesting. Yeah. That's about it.
So, why marriage and family as opposed to like some other specialization?
Because I'm convinced of the validity of the systemic model. Humans are who they are in relationship. They're not who they are in isolation, which was the great mistake of the Freudian view.
Among many.
Among many, right. Yeah, Freud was the towering intellect of the 19th century. Freud was right about more than he was wrong about, but when he was wrong, right? And it was a reflection of the culture, the whole notion of the individual as being separate and apart from the relational matrix. Okay, I was lucky enough to be in California at the time that the family therapy movement, the understanding of systems therapy was coming to fruition, and I was fortunate enough to study with many of the pioneers.
That's been really amazing.
Yeah, it was. I think it's a very accurate model.
So, the schools that you attended, you kind of already mentioned a little bit as far as like California, but excuse me. What led up to your choices with just different programs that you selected?
Well, I was subject to the draft, so if I had left the theological seminary, I would have wound up in Vietnam. So while I was both interested in the theological studies, very much so, I was also interested in this other stuff, marriage and family therapy. And the two fit together rather nicely. So I finished my Master's in Divinity degree, and then I did a Master's degree in psychology with a specialization in marriage and family therapy after that. And then I spent a number of years, a decade, in training institute, quite honestly, because much of the craft of psychotherapy we learn after we get out of school, we get done with degrees. You know, because of the American system of title protection. In other words, you jump through enough hoops, you can become a licensed something or other. Doesn't mean you know very much about actually working with people, unfortunately. Yeah. It's a craft. It takes a long time to learn it.
How did you come across the learning institution that you're talking about?
Oh, which one? You mean,
the experiential part. Right,
postgraduate. Well, that's a complicated question in that the people I had met in California, the people that most influenced my thinking, in addition to Virginia Satir, it was Paul Václavic, Dick Fish, John Weakland at the Mental Research Institute, who were doing much of the systems-oriented work. But simultaneously, I had met Eric Berne and Fritz Perls, so I was very interested in Gestalt therapy. So, you know, the way it works is you kind of pick your brand, the thing you're most interested in, and then there's training institutes around the country, and, you know, currently it's things like Internal Family Systems and Hakomi, you know, the Gestalt Institutes for transactional analysis, most of them are closed up. Because you know, guys don't know this yet, but it's a terribly faddish business.
I can imagine.
Yeah, well, there's a lot of reinventing of the wheel. Because it's the people's economic interests.
Right.
See, I've developed a theory, it works for me, let me teach my students how to do it, and you know, there's economic incentives to it. I don't blame people, you know, they have to make a living.
Yeah.
So that's how. I just came to it because of the people that I had learned from and wanted to further my training with them, or their ideas.
So out of these ideas and the training that you received, what sort of techniques do you find to be the most beneficial? Or just some that really stand out as far as like different techniques that you learn?
None.
Oh. Wasn't the answer we were looking for?
It's probably not the answer you're looking for. You know, technique-oriented psychotherapy usually is gimmicky. It's technique-oriented. It's what works is relationship. A relationship with people. Now, within that relationship, there may be, there's some techniques. I don't think of even so much techniques as much as skills. Okay, skills that are won through the hard work of being seasoned. How do you deal with an angry partner in a marriage counseling situation? How do you deal with somebody that's acting out? Okay. Most of us don't like being techniqued.
True.
So there's an irony that most graduate schools focus on teaching techniques, I guess. If by that what's meant is we all need to learn how to conduct a good interview, how to present ourselves well in a professional context, and those are all, I tend to think of that as more skill.
No. Great. Do you want to switch over here?
Alright, so what populations do you work with primarily?
Well, I work with couples primarily, families, then individuals. Age-wise, you know, I work with some adolescents. I don't work with children, except in families, because I don't believe there's generally, you know, if children are having problems, it's a reflection of this systemic problem of the family.
Right.
Yeah.
And what populations do you find most challenging to work with?
Well, you know, all and none. I suppose adolescents are a little more challenging for most people because they're generally not eager to be in therapy. So they're probably the most challenging. That's why I generally tend to work with adolescents, though, in the family context.
Okay, so adolescents are more resistant to come in for therapy.
Yeah. Who wants to go to therapy when you can hang out with your buddies at the mall?
Right.
And they're fearful they're going to be blamed.
Right.
Scapegoated, because they probably already are. That's why they're acting up.
Alright. And what issues do you see most frequently presented in your counseling sessions?
Well, since I work primarily with couples, or a lot with couples, the whole gamut from affairs, extramarital affairs, to people that aren't very well differentiated, so they can't, you know, they're not very respectful, they get a little depressed. They tend to be dysphoric is a better word. They're unhappy with their life.
Mm.
That's primarily what I deal with.
Okay.
I don't usually see people that are psychotic. Occasionally, I do.
Right.
It's not my big thing.
Okay.
So from your years of practice,
Mm-hmm.
could you maybe describe one issue that's been difficult for you to handle and to adjust to in your practice?
Yeah, most all of us, most therapists have certain categories of things that they find most challenging. Probably for me, it's for passive-aggressive men that don't want to grow up, don't want to take responsibility for themselves. I think I actually work well with them, but I have to monitor my own countertransference, not get too annoyed with them, not get too confrontive. That's for me. Probably, that's probably the biggest challenge. But for everybody, all therapists have their range where it's kind of an annoyance.
All therapists are human.
Yeah, exactly.
So, what areas of personal growth have you experienced throughout your career?
Well, gosh. I think one of the nice things about being in the profession is that we have to attend to our own growth the rest of our life. Okay? If I were out looking for a therapist, first thing I would ask in an interview is, tell me about your own therapy and your own personal growth. And if they said, well, I don't believe I need it, then I would say, well, fine, thank you, I'll see you around. Right?
Mm-hmm.
If they say, yeah, I have a regular therapy where I deal with my own issues, particularly things that get stirred up in me as a result of my work with my clients, I'd say, oh, well, you're probably who I'm looking for. Probably there's a predictable trajectory for most beginning level therapists. We start out kind of feeling cautiously optimistic that we know what we're doing, and probably at about year 2 or 3 we wake up one morning and think, oh my gosh, I don't know anything. And then we get to work on ourselves, because most of where we get blocked is with our own inability to be fully differentiated ourselves. Okay. By differentiation, I mean how do we not get afflicted by the contagion of our clients' anxieties? How do we stay calm in the face of their high levels of anxiety? And that's a lifelong development. That's the lifelong path of all of us. Say, from the time we reach libidinal object constancy at 3 years old or thereabouts for the rest of our life. How do I know myself? How do I become less anxious? How do I incorporate the experiences of my own life in a way that centers me and creates within me self-knowledge rather than anxiety? It's not what the project is. If we're therapists, we get to kind of do it because we need to, right? Mm-hmm. And we're in a profession where if somebody says, if you're with a group of therapists and one of them says, well, how's your therapy going? Well, I don't have a therapist. People look at them askance, instead of the general population, oh, you have a therapist, right? So we get to master ourselves. That's life. That's what living is, isn't it? How do I know who I am?
So that kind of...
In by the way, a culture that tells us knowing who we are isn't the goal of life. The culture tells us the goal of life is to be consumers, to be mindless, to drink Coors Light and have a good time, right? And watch football. That's what the culture tells people, right?
So, kind of leading on off of that, the stress that you experience or the anxiety, you kind of talked a little bit about countertransference as far as like one of your personal challenges. How do you deal with that in the throughout your career?
Well, you know, the way everybody else does it. You know, healthy adults do it, right? We need to exercise, we need to pray, meditate, eat right, take care of ourselves, have our own therapy, consultation and supervision particularly when we're starting out. Right? My advice to young therapists is go to the best training program you can get yourself into after you graduate. Work at it. Realize there's no shortcuts to mastery. Because a lot of therapists in the phone book, 2/3 of them I wouldn't send my dog to. Not because I'm so picky, it's because they don't have they haven't reached that level of mastery.
Mm.
That's the difference between a master therapist and somebody that's, you know, good enough. No, that's all right. I mean, we go to the doctor, our family doctor. Chances are what ails us gets taken care of there. But if we have a neuroblastoma in our brain, we better go to somebody that really knows about neuroblastomas, right? That kind of thing. Then it comes with getting seasoned. The biggest challenge in many respects is to not take it personally. It's stuff that people are doing, feeling, struggling with. Right? The irony that many of us that get into the field are people with, you know, big hearts, and we really want to help people and care about people, and yet at the same time we have to learn that it's their therapy work, not ours. Right?
Right.
That's kind of one of the things that comes with seasoning. And we need to get away. We need to structure our lives in a way that we're reminded that there's a bigger world that's there to sustain us. If you never get outside your office, pretty soon you start thinking people's problems are it. They're not.
That's really good.
Yeah.
So that mastery that you were talking about, as far as like a training program, would you say that that's earned through that, like the seasoning that you're mentioning?
Yeah. We need to have the kind of training where what we actually do with our clients is witnessed, videotaped. We have to watch it time and time again. We have to endure the discomfort and the scare of somebody sitting down with us and watching what we actually do with our clients and saying, well, tell me about this. What were you thinking when you did that? Or, I used to get the feeling you kind of got lost there. Yeah, boy, I was. Right? In fact, I was, maybe I would retire and drive the city bus at that moment, right? Mm-hmm. I mean, that's what it takes, in my view, if you really want mastery. So that's the kind of, you know, training that's really worth getting, where people are quite insistent that you show them what you actually do. Because then as we, you know, it's uncomfortable, but once we get there, you know, then we start to realize that we're the differentiated human beings that we can become. It's about, I don't have to take this personally, it's about learning a skill. Complicated skill.
Yeah.
It has a lot to do with us. You know, we're the instrument. You know, the plumber has his wrench, the carpenter has a saw. We have us. So we got to keep the instrument in good repair, and it's complex to learn. So that's what I think. All you know, if you guys, you two as therapists in training, get that idea and then take it and really use it to grow, so to become masterful. Then you'll have really rich, rewarding careers. Then it's kind of, in a sense, not stressful. To come back to that, it's not particularly stressful. What's stressful is, you know, flying a 747 when you don't know how to fly it. That's stressful. See, it's stressful to sit in a room with people when you're winging it. Not that there isn't in every moment of psychotherapy a certain degree of whew, I've lost the thread, I'm not quite sure where I am. But with seasoning, we begin to learn, oh, well, it comes back.
Hmm.
You know, we get back to it, almost always, right? We can make mistakes, you know, that the problem is when we deny that there are mistakes. That's where in all walks of life, people get in trouble, right?
Right.
It's when we say, oh, man, blew that. What am I going to do about it? How do I get a consult? You know, call up my friend, hey, you ever deal with something like this? You know, that kind of thing. We have to get, what reduces our stress is to get beyond the idea that we should, out of our own heads, know everything there is to know and never have to study or consult with somebody or reach out, you know, and get somebody to help us with something. Well, that's kind of true of most walks of life, isn't it?
Yeah.
Right?
So the constructive criticism or constructive feedback that the training program gave to you, it was very vital, and you were able to, I guess, not take it personal and feed off of it?
Well,
Okay.
therein lies a lot of our growth. It's what makes, probably what I think being in a clinical training program without having the therapist at the same time is kind of cruel and unusual punishment. It's impossible not to take some of it personally, especially if we come out of backgrounds where we tend to idealize the idea that, well, that perfect exists, or that we should know all the answers, or that you know, that we're not qualified to do the work until we, you know, are perfect, because that just makes us miserable, because there is no such thing as perfect.
Mm-hmm.
But many of us that go into the field struggle around letting relationships sustain us. That's just my general observation, right? So yeah, we can't help but take it personally, because various parts of us get stimulated, even when other parts of us are saying, well, I can take in this feedback. Some other part of us may be saying, well, this just reminds me of my mother criticizing me, or you know, the time I got an F in geology or whatever, right? That's the integration work that we have to do. So we have to hang in there, and you see we keep identifying the parts of us that get triggered by certain things, and then we have to work that out so that they, you know, we don't get so triggered.
Mm-hmm.
And then we still get triggered sometimes, and we have to know what to do about that.
Right.
Right? But believe me, that's what makes it kind of really an interesting career, right? It's a lot less boring than driving the city bus.
Oh yeah.
Yeah. But there are days when driving the boredom of the city bus would be really a good deal.
What were some of your fears going into the field, if you had any?
Well, believe me, I had plenty of them. Probably given my background that I wouldn't do it right, that I would harm somebody, those kinds of things. With years of experience, now I have a different appreciation about that. I'd rather have my brain surgeon be a little more on the compulsive side than say the brain surgeon said, no, when it came to treating neuroblastomas, I cut class that day because I was hungover, and you know, so when I get your head open, I kind of think I know what I'm doing, right? This is what you want, right? So you see, anxiety propels us to work hard. But too much anxiety makes us nervous, and we can't do our best, right? So yeah, I'd rather people came to me as supervisees or trainees saying, boy, I'm sweating whether I'm doing this right or not, because I at least know they're paying attention, right?
Mm-hmm.
But if you're so worried about doing it right that you get paralyzed, well, then you can't be your best. Does that make sense?
Mm-hmm. Oh yeah.
Right. We all have our thing, whatever it is, but if we're people with goodwill, it's usually that we'll fall short, or that we'll hurt somebody, or we'll miss something important, and that tends to make us more thoughtful.
I think.
Yeah.
Well, what are the benefits of being a licensed marriage and family therapist?
Well, The living's reasonable. You know, private practice isn't as lucrative as it seems on the outside because we have to pay all of our Social Security tax instead of split it with an employer. Vacation pay is poor. Sick pay is poor. In other words, if I don't show up and work, there's no company, no corporation, you know, paying, you know, there's no agency that pays my salary, gives me sick pay. I think it's fun to work with people where you stand a pretty good chance of really making a difference in somebody's life. The divorce epidemic in the United States has been profoundly destructive. It's very destructive to kids. And I get a lot of satisfaction out of heading off unnecessary divorces. I think it's very reasonable to say 60 or 70% of the divorces in the United States are completely preventable. Because what marriage makes us all do is grow up. Either of you married?
No, almost.
Yeah, almost.
Engaged to be engaged.
Yeah. Yeah.
Almost.
Right. Pre-engaged, or pre-engagement.
Yeah.
So there's a lot of satisfactions. And I'm much more interested in working with couples and families than I am with individuals. Even though individual therapy is in some ways easier because there's no conflict in the marriage. Right? Though there ought to be a lot more. Right? People come in and start complaining about their spouses. I tell them, well, wait a minute, what are you doing to make your spouse that way? Which is, then that's when it gets interesting. If you sit here and say, oh, well, you know, pretty soon you're undermining the marriage, right? A lot of marriages get undermined by individual therapy. Okay? Somebody comes in, says, oh, let me tell you about my wife. She's impossible, blah, 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 right? So, you're going to empathize with the person, or are you going to challenge? What are you doing to make your marriage better? How come your wife behaves that way? What part do you play in making her behave that way? Well, you learn a lot. Sometimes they say, well, I don't think I can work with you. Right? Well, what do you want me to do? Sit here and agree with you? Your wife's a schmuck? Right? There's a lot of bad therapy that goes on in those realms. Somebody says, well, you know, I've been listening to you for the last 6 weeks, you know, and I hear your wife's got some very, very serious problems. She probably needs 10 years of individual therapy. Do you consider divorce? It goes on. I think it's unethical. Highly unethical, but it goes on. Oh, I hate to say this, Bob, you should run. Or, you know, your wife's, I can tell, your wife's got borderline personality disorder. It's unethical to diagnose people you haven't seen. Right? But that's what I'm saying. That's why I don't find, there's an exception to that where I do enjoy individual therapy is somebody that needs a deep reparative experience of a relationship with somebody that where they can both bring the broken parts of themselves out into the open. Okay. That's a little different map.
So sometimes you see the whole family and you see that brokenness, so you'll individually counsel them and then stop seeing the family? Has that happened?
Oh, rarely. Chances are, for most of us, if we're getting the itch to, this happens a lot of couples, poorly trained couples therapists. Man, they're sweating bullets, the white-hot conflict of this bickering, mean couple that are lacing into each other and they feel helpless, they can't stop the cycle of blame. And in their desperation, what they usually do is they say, well, you know, we've been working at this for the last 8 weeks, I don't think we're making progress. The reason we're not making progress is because you both need individual therapy. And what they usually do is they keep the one they like better and refer out the one they don't like so well.
I see.
all right, and begin to either undermine the marriage, or they postpone these two people's growth. So they wander off, they get individual therapists, and they're talking about all of their complaints about the person that's not in the room, right?
Mm-hmm.
And you know, what's the benefit to that? Usually makes the marriage worse. So that's why you got, if you're going to work with couples, you have to be really well trained so that you know how to confront this inability for both people to be differentiated enough to run their affairs with each other differently than through complaint. Does that make sense?
Mm-hmm.
Yeah. So no, usually, if people come as a family, rarely you might see some need to get somebody into an individual therapy. From a purely systemic viewpoint, the identified patient, the one that looks often the worst in the family, is the one that's mirroring the dysfunction of the whole family, right? That's where the individual models broke down. I mean, before the systemic revolution of the late 60s, really what passed for couples and family therapy was refer everybody to individual therapy, and when they've got their own work done and they're no longer dysfunctional people, then you can bring them back together and everything will work. Well, as anybody can tell you, that it's a whole different matter when people are in the relative safety of the individual therapist's office. Is a very different thing than being confronted with the person with whom they've had a difficult relationship, right? All of us do better with strangers, in a sense, than people that we've had struggles with, right? With strangers, we're perfectly cordial. We don't know each other well enough yet to have any fights, right? I go to professional meetings and everybody's in love for the first, because they only last 3 days, and everybody's on their best behavior, and everybody's relaxed and going out to dinner and renewing acquaintances and having a lot of fun with each other. And then somebody says, "Oh, it's too bad that we can't just live with each other like this." To which I say, "Yeah, well, because in about 10 days we would find out what our conflicts are, right? Then we start having conflicts with each other." So individual therapy can be really helpful to people, but when it comes to relationships, you still got to work it out with your interlocutor, right? Your partner, right? It's easy to love all humankind. It's just the sucker I'm sitting next to I can't stand, right? Is that the way life is? We all have that experience, right?
Mm-hmm.
In the abstract, I love everyone. It's this wife of mine that's driving me crazy, right?
So there's not a certain model that you mirror in your sessions?
Oh yeah, very definitely. A systemic view.
Okay, and that was by Virginia Satir?
Yeah, well, the whole marriage and family therapy movement that Virginia Satir was one of the founders of. The other towering parts of that movement were Carl Whitaker. We're going back in ancient history here.
You said Fritz?
Yeah, Fritz Perls was the originator of Gestalt therapy, along with his wife Laura. He had a partial appreciation for the systemic view. The other person I met in California was Eric Byrne, who was fashioning a much more systemic view out of psychoanalysis in his transactional analysis theory. Okay, just look up family therapy on Wikipedia, and you'll get the list of the foundational people in the marriage and family therapy movement.
Okay.
Yeah. It's become so much embedded in the way we look at things now that it no longer has the kind of revolutionary feel to it that it did then.
Right.
Yeah.
Okay.
Because it was a huge break from the psychoanalytic worldview of of a reification or an overemphasis on the individual. Philosophically, we've changed as a culture from, well, there's a lot of what our political battles are about, is, you see, the place of the individual within the context of the collective. As though we can, any of us, be individuals without the context of our relationships.
Mm-hmm.
We simply can't. We're hardwired to be in relationship. Okay?
Yeah.
Few people out on the outliers, hermits that live in a cave maybe. But the primary motivating part of the human experience is not the drives of sex and aggression, it's the need for relationship.
Mm-hmm.
Okay? Our brains are designed to seek out relationship. Being seen as significant in relationship is what we all crave at the deepest levels. Okay?
Mm-hmm.
So in terms of techniques, Terry, there's in the background for me, there's systems, gestalt, transactional analysis. I've incorporated in the last decade much of the neuroscience, which validates what we already knew, from other avenues about people. But that's my primary theory base. All theory bases have elements of everybody else's. Whether people are conscious of it or not.
So you just use your own theory but combine all of those, or do you use different theories for particular situations or particular sessions?
Well, that's an excellent question. I think there's a big difference between being eclectic versus integrative. And I tend to think about that we need to take whatever elements of any theory and integrate them into something that's kind of cohesive for us. Okay? The tendency in therapy is to switch frames of reference when there is a struggle or something we don't understand, or there's a conflict. Okay? And that's why as we get more seasoned, we have to have a particular viewpoint that we've incorporated that becomes the primary way that we approach things. Does that make sense?
Mm-hmm.
A primary way that we approach things so that we maintain a consistency, and then we get the results that we get. We learn things, right? We get whatever transferential things come out of the interaction with somebody. That's very different than when we begin to get resistance of us as therapists kind of moving away and trying to find some other way to approach it, if you will. That's not always bad, but a lot of times that has to do with our own inability to hold our ground around something because we're not confident of our own perspective. See, and the reason for that is if we're going to be change agents with people, if we're chasing them around, trying to figure out how to placate them or please them or fix them, chances are we're not doing a very adequate therapy, right? Because if it's real therapy, it's going to be work. See, it's going to be work, hard work on. I mean, that's my mantra every day. May I come in and, my prayer and mantra. Okay, how am I going to make this work for people? Not laborious, painful work, but where at our worst is when we're either trying to gratify them, fix them, explain them away, rather than hold them in a context that allows them to grow and change, right? That's the difference between, I think, psychotherapy and counseling, if you will. Counseling is, in a sense, well, put your money in this bank, they pay a higher rate on certificates of deposit. Psychotherapy is, how come you're bringing this question of where to put your money into this relationship? Does that make sense? Well,
Yeah.
gee, now that you ask, it's because for all of my life, I've never had confidence in my own decisions. Then you've got psychotherapy. Okay, well, let's track that down. How come you don't have confidence in your own decisions, or in your own mind, or in your own beliefs? That's personal growth. That's psychotherapy. Counseling is, well, do this, or do that. That rough distinction makes sense?
Yeah.
Mm-hmm.
Okay.
So, I think we're about finished, but do you have any just closing thoughts or maybe even just advice for someone who's interested in pursuing marriage and family therapy?
Oh, I think what I've already said, get yourself through school and then get yourself in the best, highest quality training program you can get into, and really let somebody mold you and teach you how to be masterful. Then you'll have fun at it. Then it gets to be fun. It's it's enjoyable. You get a sense of, for me at least, marriage and family work is so immediate. You help people change, and you get a better show on the road. And that's kind of what it's all about, right?
Mm-hmm.
That's what matters. Monday morning, how am I going to be more effective in helping people change and grow, stop their destructive patterns, not hurt themselves or other people through unnecessary divorces or those kinds of things.
Well, thank you.
Because that's my take on it on a Thursday afternoon. Yeah.
Well, thank you. You shared
Yeah.
so much with us, and that was,
Okay.
we learned a lot about licensed marriage and family therapists. And it's definitely good to hear from your perspective, where you've been in the field for quite a while.
40-some years.
Wow.
Yeah.
Okay.
Yeah.
So you obviously enjoy what you do, and that's reassuring for some of us who want to go into that
Mhm.
field.
Well, you know what's really interesting from my perspective about it is I'm going to be 67 next month, and there's probably few fields that, except in the human services, where your best is in your later years. Right? If you're climbing utility poles for the power company, chances are 67 you're not so good at it anymore, maybe. But if you don't lose your marbles because you haven't taken care of yourself, it's kind of, you just keep growing that body of knowledge and experience to where it gets to be funner. And nice thing I'm liking about private practice is I'm getting to this stage in my career is that I can set my own hours. I can have right now I work 4 days a week, and then next year I'm going to go down to 3, and then the year after that to 2, and then however I want to do it.
Mm.
As long as the phone
Nice.
keeps ringing, I can sort of tailor make it to my own desires, which I like.
So have you not been in private practice your whole time being a licensed in marriage?
The vast majority of it I have been.
Okay.
Yeah, like a lot of people, I worked in a mental health center in California for a while when I was just getting out. Kind of because if you don't, it's really hard to get enough hours racked up to get licensed. But after that, yeah, I've been in private practice 36 years of that time.
Wow. All right.
Yeah, and I've had a wonderful partner, and she's been very supportive, and we've been very supportive of each other, and it's just really worked out really well for us, for me to be in private practice, because I could have a little more flexibility. And she was a teacher, and that worked nicely because we always at least had that guaranteed income coming in the door.
Right.
So it just worked well.
Nice.
Yeah. Well, how about you two? Any other questions? Or?
I think you answered everything. You
Yeah,
answered
All
more
right.
than
more than enough.
Yes.
All right, yeah,
Sure.
you-
you were great.
thanks. Yeah, you can tell I'm passionate about it and I've been thinking about it.
Well, it must be nice to talk about yourself because you probably don't get to do that very often in your sessions.
Just with my therapist.
Oh, yeah, that's right.
Yeah, that's kind of nice to be at a